Good evening. I'm George Latimer, Westchester County Executive, and welcome to our Facebook Live Town Hall discussion of COVID-19. We're now beginning the 11th month of dealing with the pandemic. It's been quite a while. There's a great degree of pandemic fatigue, but we've reached a very important milestone in the battle against COVID, and that is now the presence and approval of vaccines that can protect us from the COVID-19 virus. And it didn't come a day too soon, as we've seen a rise in the number of COVID cases, hospitalizations, and fatalities over the last few months that begin the process of mirroring what we saw in the very beginning of this in March and April of this past year. We're here tonight for the next hour to talk with two of our top medical professionals in Westchester County government, to talk to them not necessarily about when you're going to get the vaccine and where you're going to get it, but the content of the vaccine itself, to understand the science behind it and to understand the medical applicability of it. So I'm very happy to have with me here tonight Dr. Charlita Amler, who is our Commissioner of Health. We've had her interviewed before, and we're very happy to have her back. She has been the point person on our public health issues here in the county, and with COVID-19, a very busy year for Dr. Amler. And one of her colleagues in the Department of Health, Dr. Dial Hewlett, who is one of our three medical directors for the Division of Disease Control. And Dr. Hewlett is an expert in this area specifically. And so Dr. Hewlett and, of course, Dr. Amler, thank you very much for being with us tonight.
Our pleasure.
Thank you.
Most of us who are everyday individuals, laymen, if you will, civilians, really don't grasp the medical impact that we face in terms of the COVID virus. We know that it's something that can harm us. We're concerned. We want protection from it. And for the longest while, we waited to hear that there's a vaccine. I might add that also we might see an antiviral treatment that would happen for the individual who becomes sick in the hospital. But the concept of finding a vaccine has been very critical to us in the way we look at this, so that we can see a light at the end of the tunnel. Now, the tunnel still continues because we have 1 million Westchester residents and 320 million residents of the United States of America, and then worldwide, since this is a pandemic, multiple billions of people. So until everyone is vaccinated, we can't be 100% sure about the spread of the virus. But the first question that I'd like to ask, and then we'll go to Catherine Chaffee, who's our Director of Communications. You've both been involved in vaccinations to prevent other diseases. Certainly as a child, I grew up, child of the 1950s and 60s, being vaccinated for a host of childhood diseases, whooping cough, mumps, chicken pox, and a host of things. So being vaccinated in the 1950s was sort of de rigueur as we found cures for polio and so forth. As you look at this particular disease, how critical, Dr. Amler, is having this vaccine in order to get COVID under control?
Well, I don't think there's realistically any other way to go back to the world that we knew before last January without a vaccine. I mean, we've tried all of the things that have been advised, social distancing, masking, closing down facilities, restaurants, schools, quarantine and isolation. And yet, here we are in January of 2021 with numbers that are equally as high as we saw in March and April of last year, despite our best efforts. So I think that the major way, the most important tool we have right now to get back to life as we knew it before COVID is a vaccine. And we're lucky that we have multiple vaccines done by multiple companies in record time. And so right now what we have to do is to help the public understand what vaccines can do for them, who should be vaccinated, when, the limitations of vaccine, and we just have to roll this process out. What I think most people don't understand is that once we start, we're in the middle of vaccinating the public right now, but that doesn't mean that we can stop wearing masks. It doesn't mean that we can stop social distancing and doing all of the things that we've done before. It just means that eventually we hope that we will vaccinate about 70 to 80% of our population and we'll reach herd immunity, which means that we will have less of a risk of widespread outbreaks of this virus.
Dr. Hewlett, just to follow up on that, and then we'll go to the questions that are coming from the folks who are watching through Catherine Chaffee. The concept of using a vaccine to prevent a disease from being, caught by an individual, is that a commonplace reality in our medical world today?
Yes, it is. The concept of vaccines goes way, way back, and prevention is always much better than the cures, as we always say. This is a rather unique situation because this particular virus was responsible for, is in the family of viruses that was responsible for about 15 to 30% of the common cold. And for some reason there was a change, and all of a sudden it started to cause havoc and was associated with pandemics. So the fact that we have vaccines that are available, and there are two of them that are approved for emergency use right now, the Pfizer vaccine and the Moderna vaccine. Both of these vaccines have gone through rigorous testing, and they are available and they're being used throughout the United States to immunize people. And we're hopeful that people will avail themselves to being vaccinated. Here in Westchester County, we're using the Moderna product. It is very similar to the Pfizer product. They are both what we call messenger RNA vaccines. This is new technology. People are not being injected with virus. They are being injected with a material that will cause the cells in their body to produce antibodies and to induce a memory so that they will be prevented from getting the infection. And that's directed against what we call the spike protein of the coronavirus. So we're very optimistic. It's going to be a slow process. And as Dr. Amler already mentioned, even though we have started with the vaccinations, everyone is still going to have to wear their masks. They're still going to have to exercise social distancing. We're still going to have to avoid large gatherings until we get to that point where we have reached that herd immunity.
Now we'll have Catherine Chaffee has a series of questions that she's gotten from the public. You're welcome to communicate on Facebook with your comments. We're not going to be able to get all the questions in the next 50 minutes, but we'll do our best. Catherine, why don't you direct questions from this point forward?
Absolutely. So I want to thank the public for sending in questions for the past week. We've gotten hundreds of questions, and as the CE said, we're not going to be able to get to all of them tonight, but we'll try to get to as many of them as possible. The one question that we got over and over and over again is, how do we know the vaccine is safe? Dr. Hewlett, considering your past and where you've worked before, why don't you take this question?
Certainly. I know that there has been a lot of concern about the speed with which the two vaccines have been developed. There's a lot of concern about that, obviously. I think that people have to keep in mind that work on the coronaviruses and on the development of a vaccine actually began in the year 2003, 2004, when the SARS virus was first described. And so that work, preliminary work, had already been done. The FDA has essentially done a great job at reviewing the data that was created by both of the companies who were the developers of these vaccines. For both of the vaccines, for both manufacturers, they had clinical studies which involved from 30 to 40,000 individuals from around the world. And they looked very closely at these individuals, monitoring very closely for side effects of the vaccines. And from all of those individuals who received the vaccine in the clinical trials, the rates of serious side effects were extremely low. The common side effects were very mild, which you would expect with just about any vaccine that you're going to be giving. And so I think that we are convinced that this is a safe vaccine. Not only did the FDA review this data, but another group of individuals who are not associated with the government, who are from the academic community. It's called the American Committee on Immunization Practices, and that is, of course, sponsored by the Centers for Disease Control, but they are scientists and members of the academic community. They also reviewed all of this data, and they made recommendations on how these two vaccines should be given. So I'm certainly convinced We also have had independent task forces that have looked at the data. There are task forces in the state of New York, the state of California, other states. I had the privilege of sitting on a task force that was put together by the National Medical Association, and we had presentations from the manufacturers. And so we are convinced that these vaccines are safe, and in fact, I have received the vaccine, and I am encouraging other people, my colleagues, my family, and my friends to accept the vaccine once their time comes and they're in a group eligible to receive it.
Okay. Well, the next question, we're going to go right to Facebook, and this question is from Nadine. She says, and County Executive, perhaps this is a question best answered by you. Please explain how you are administering the vaccines to the residents of Westchester County.
Well, the first thing to understand is that this program falls into the same category of all other COVID-related decisions. And back in March, when we first started to deal with this, Governor Andrew Cuomo used his superior executive authority as the governor of the state, and every governor did this. Governor Lamont from Connecticut, Governor Murphy of New Jersey, all across the country. They used their statewide executive authority to make all of the relevant decisions in fighting COVID within their states. And I'd have to say this is really because there was a lack of a federal program in which the president would use his further superior authority to then direct it. So absent that, each governor took the authority on to do that. That's been the story of testing. That's been the story of creating phases by which things close and which things open. The governor and the people that advise the governor, his medical professionals, have been the cutting edge of what's happened in terms of the decisions to do each of these different things along the way. The same is true for the vaccine distribution. What the state has established at this stage of the game is a series of categories of individuals who should be administered the vaccine. And those categories, and he's broken them into phases, phase 1A, 1B, 2, and so forth, represent the priority categories at first and going to areas that are less vulnerable and therefore get the vaccine a little bit later. What hasn't happened with this list of priorities as we're having this conversation is any set of deadline dates that are attached to moving from category to category. And I gather that's because the state is trying to get a guarantee of the available product from the national level so they know how much product they have, and then therefore they can make a decision as by date specific will move from one category to the next. What would those categories be? Right now, as both Dr. Amler and Dr. Hewlett indicated, we are administering vaccines. Hospitals are administering vaccines. There are vaccines being administered through pharmacies, chain pharmacies, to categories of people. Right now, what's happening is we have healthcare professionals who are in direct client contact that are being administered here in Westchester County, and we have an allocation that the county health department is distributing. It's to nurses and doctors with direct contact with clients. It could also be respiratory individuals, pulmonary individuals in the medical field, up close and personal, interacting with those who have COVID. The pipeline that goes through the pharmacies, and they've identified a couple of major chains. I believe CVS, Walgreens would be two of them, if not the majority of them. Nursing home residents and nursing home staff individuals are eligible to receive vaccines in this phase right now. The third category right now are EMS, emergency medical technicians, service personnel. And as you would imagine, if somebody responds to a 911 call at somebody's house, those individuals have to be close and personal with whoever the patient might be. That person might have COVID, and we want those workers to be vaccinated. And so that is all what we're doing right now. Dr. Amler, in fact, has used about half of the allocation that we've received. But Westchester Medical Center, some of the other medical centers around the county have received a certain dosage amount sufficient to deal with individuals within those categories that are currently being vaccinated. In the next cycle of individuals, once that's done, we move, as the state has laid it out, again, these are state categories, we move into an area of essential workers. And essential is a subjective decision made by the state that determines that certain lines of work are essential to the functioning of the society, to the economy, and so forth, and that those people need to be protected. They include the rest of the first responder community, firemen, policemen, and so forth. They include people in the education field. That's one of the identified areas. So I assume that will mean teachers and people who work in a school setting, cafeteria workers, etc. They've identified something near and dear to our heart, bus drivers. We have a Department of Transportation within the Public Works Department. We run a Beeline bus system. We want bus drivers to be inoculated so they can stay healthy and continue to drive their routes and so forth. And then it goes down the line. There are certain medical pharmacy workers that aren't part of the first phase, phase 1A. They will be part of the second element of this, and that's the next one that comes. Ultimately, when somebody says, what's going to happen, they're thinking themselves, where do they fall into the mix? After essential workers, it is envisioned, without target dates attached to these things, that we'll be dealing with a cohort of senior citizens. Older seniors first, younger seniors to follow. I am officially a younger senior, under the age of 75, over the age of 65. That's the last time the word younger has been attached to me in the last 15, 20 years. But as you would imagine, the older the senior, the more vulnerable to the disease, so they would get priority. And also within that cohort, we understand, will be people who have special medical situations, compromised immune systems, if a person is getting cancer treatment, has AIDS, if they're eligible for the vaccine, and there is a medical review that a medical doctor is going to have for their patient. But if they determine that the vaccine is appropriate for that patient, that also goes in the early cohort. Then once you've vaccinated, based on how the states laid this out, the senior population, then we're ready for the general population. And if you're thinking about an iceberg in the ocean, what you see is 1/8 of the iceberg and 7/8 are below the iceberg. These targeted areas for vaccination are a relatively small portion of the society at large. When we get to the non-senior general population, that is a huge challenge of vaccinations. I don't know if the polio mass vaccinations of the 50s are the most reasonable comparable to this, but this is vaccination on a level that we haven't seen. Every year we talk about getting your flu shot, and it's a promotional effort, and we're out in the community. This is on a much greater level than the promotion that we use for flu shots. And I would have to say that when we get to the general population at large, and this is where the medical experience is not as important as the governmental experience, we know that we have to make these things as available in as many convenient geographical locations as we can. People, human nature, will not drive 10 miles to get a vaccine. We need to put it as close to them as possible. And yet, and Dr. Hewlett alluded to this, the vaccine product, certainly the Pfizer product, has to be stored at very low temperatures, and all of the product has to be kept in an appropriate scientific manner before it can be distributed. My understanding is these products, once unfrozen, cannot be refrozen with efficacy. So we have to make sure if we pull out 20 units, we have 20 people lined up and ready to go. And we want to avoid in the distribution what I've seen on television in Texas and Tennessee and Florida, long lines of people waiting to get a vaccine. Then the line closes because they ran out of product, and people are upset, and they don't want to spend all day doing this. The state has identified a system by which every vaccine will be given out based on an appointment. Now, easier said than done. You have to go into a centralized data system, and that data system has to work perfectly, no breakdowns, no glitches, and all of the different mechanisms. So we haven't done anything like this, certainly in our lifetime, and I'm not even sure if 100 years ago that pandemic was could not be dealt with this way. So we are in new territory. We are, as we've all been saying, building the plane as we're flying it. And the short answer is, until we know how much product is going to go from the federal level to the state probably won't identify target dates to go with each of those cohorts. Our job as county officials is to, once we know what those target dates are, to organize the groups of people that have to be vaccinated so that they can be done efficiently and quickly. That will be a massive task. So stay tuned.
Okay. The next question comes from Anne Fabrizio on Facebook. She asks, how long will the vaccine be effective for once you have it?
Well, we really don't know yet. And so hopefully the 2 doses will be sufficient and people won't have to be revaccinated. But as we vaccinate people, we will of course continue to monitor this. And as we have a large number of the population vaccinated, we'll be able to get a better understanding of if people who've been vaccinated go on to develop COVID. And if so, at what duration, how long since their vaccine. There are other ways to check to see if people have a lasting immunity. But the more people that are vaccinated, the better our ability to monitor and to understand. And with time, we'll have a very clear picture on that. Right now, we're not exactly sure.
Okay. The next.
I don't know if Donald has anything to add to that.
Well, the other encouraging news that we have from the vaccine studies is, and this isn't saying exactly how long the immunity is going to last, but we know that the vaccines will induce an antibody response that is probably maybe 4 times or maybe even 5 times higher than the level that you get from natural infection. And so that's very good news. But we don't know exactly how long this immunity is going to last, but we're very hopeful, but we're just going to have to observe.
Have to wait and see.
Mm-hmm.
The next question comes from Daphne from Yonkers. She asks, if a person does not take their second dose within the allotted scheduled time, what is the protection percentage and or the outcome for these people in terms of ill effects?
Well, they won't be fully immunized. And, we know that if you get both doses, the effective rate is about 94 to 95%. So we would certainly encourage people to not only get that first dose, but to get the second dose as well. Very, very, very important. Get that second dose, get both doses so that you will be fully immunized.
Okay.
If I may just share an anecdote relative to this, it's not germane to COVID, but I had an incident about 20 some odd years ago where I might have been interacting with a bat. We didn't know for sure. At that time, I went to the then director of the county health department, and the protocol for treating a potential bat bite, which would be a rabies situation, involved me getting 6 shots that I had to take over the period, or 8 shots that I had to take over a period of 6 weeks, something like that. It could not have been less convenient for me. And as the doctor explained to me when we were talking about convenience, he said, well, George, here's how it goes. If you didn't get bit by the bat, then you have nothing to be concerned about. Or if the bat bit you and he was rabid, then you have nothing to be concerned about. If you take these shots, if the bat was rabid, you have nothing to worry about. But if you want to roll the dice with your life, don't take the shots, or take a couple of them. The bat is rabid, and you will have a very poor outcome. He said it much more graphically. I'm not going to do it right now. So a rational person says, I might have been exposed to rabies. Give me every shot you can get. So I think, now I'm speaking not as a medical professional, as an individual, and I went through a quasi-similar situation. Take both shots. Take both shots. Simple.
I absolutely agree. Absolutely agree. And, with Moderna, it's 28 days later, so you're not waiting 6 months to take that shot, so you're not likely to forget. And in fact, when people come in and get a vaccine, the first vaccine, they're going to give you an appointment for that second vaccine. And we advise you to go to the same location that you got the first vaccine. And also, it's very important to know that you need the same type of vaccine. So if you got the Pfizer vaccine the first time for the first shot, you're going to need Pfizer for the second shot. If you got Moderna for the first shot, you need Moderna for the second shot. You don't want to be mixing those. So it's very important. They're going to give you a card that states the date you got your vaccine, what type of vaccine you got, and it is recommended that you go back to the same location and that you get the same type of product that you got the first time.
Okay, another question that we got, again, many times over is, I heard that the vaccine was developed too fast, so I'm nervous about getting it. Is that true?
A lot of people are concerned about the speed with which the vaccine was developed. I think that we did speak about this earlier when we talked about safety. A lot of the groundwork was done already. And so although the vaccine was developed over a period of several months, there had been a lot of background work that was done prior to that time. The other thing I think that people should keep in mind is that the technology that is now available to us was not available years ago. And that was one of the reasons why this we were able to have this development occur so quickly. The genomic sequencing, as we call it, was known back in January of last year, and that was really the foundation for the development of the vaccine. The hardest part about developing a vaccine nowadays is understanding what we call the genomic sequence. And so this, although I know that people are concerned about how quickly this occurred, I think it's a tribute to the level of technology and science that we now have.
Okay. The next question is, I'm worried about the side effects of the vaccine. What are there? Now, Dr. Hewlett, I know you said you got the vaccine already. Dr. Ambler,
I did.
did you
Sure.
both get it? And can you talk about that experience
I
a bit?
got it. I think the most common side effects that are being seen with both the Pfizer and the Moderna, and they're both the same, they're both mRNA vaccines, is a little bit of soreness in your arm. The soreness that I experienced was less than what I experienced with the flu shots. It was of less than a day's duration, and it certainly was not incapacitating. I hardly knew that I had actually been injected. Other things that some people have reported is they may have a bit of fatigue or tiredness. That is one of the main things that has been described. After the second dose, there have been some people who have experienced what we call systemic side effects, which include things like mild fever, and that typically goes away usually after a few hours. So I think that when we look at this and these mild side effects, which do occur, and probably more than half of the people that get the vaccine are going to have at least one of those things occur, we have to think about the alternative. And just as Mr. Latimer was mentioning, we've got a 2% mortality rate associated with COVID. We have anywhere between 10% to as high as 30 to 40% of people who develop chronic illness after they have COVID. And so I think that people have to weigh that out. And certainly if you think about it and if you're rational, it's much better and the odds are with you in terms of getting the vaccine versus risking getting COVID.
Okay. The next question comes from Rami on Facebook. They would like to know, will we be able to get the Pfizer vaccine here in Westchester? I know you mentioned that we have the Moderna one.
And I don't think we know that because, whatever vaccine we get is what the state of New York is sending us. And so I won't know what's coming until it arrives. So I simply don't know the answer to that at this time.
The next question that we got asked a lot of is about children. Can children get the vaccine? At what age does it become safe for a young person to get the vaccine?
Well, I'll start this question and then I'll move it over to Dr. Hewlett. The studies were not done in children for Moderna under the age of 18. Pfizer studied individuals over the age of 16. So anyone, depending on the product that you have to vaccinate with, if it's Moderna, we can't vaccinate anyone who is under the age of 18. Now, so why is that? What does that mean and why is it important? It's very important that we realize that children, as we know, have done relatively well with this virus, with the exception of something called multi-system inflammatory syndrome. And what we know is going on there is that it appears that family members who are positive for COVID expose children in the home. The children probably have no symptoms initially, and about 6 weeks after having COVID, they develop this multi-system inflammatory disorder, which is an autoimmune response of their body. And those individuals can get quite sick. So it's very important that the adults in that home, whether it is the parents, so if you've got children at home, it's very important, young children who cannot be vaccinated, very important for anyone who is caring for them, whether it's a babysitter, a grandparent who watches them frequently, or the parents or other adults in that home, to be vaccinated so that the children who cannot be vaccinated are protected. Dr. Hewlett, what would you like to add to that?
I agree with everything you're saying, Dr. Amler, and I think the thing that we know is that the vaccine is being studied in children down to the age of 12, and we're hoping that there will be data available to support use in children down to the age of 12 in the very near future. In the interim, though, as Dr. Amler was mentioning, we are hoping that there's going to be herd immunity. We know that most children get the infection from the adults who share the household and share the environment. So our hope is that we will have herd immunity developing and that will protect the children. A little story that I'd like to share with you with a disease called pneumococcal disease or invasive pneumococcal disease. This is a disease that was very, very common in children until we had a vaccine. And once we had widespread use of that vaccine, it caused the disease to disappear not only in children, but also in older adults. And it was believed that the children were giving it to the older adults. And there was such a dramatic decrease in disease among the older adults that a lot of the officials started to say, well, maybe we don't even have to have an approval for the adults because the herd immunity was so effective in the children. So I'm hoping that we'll see exactly the same thing happening with this disease, with the COVID vaccine, but everyone is going to have to roll up their sleeve and take the shot.
We got a lot of questions from people with very specific medical situations, whether it be diabetes or Bell's palsy. Can you talk to the public about what they should do if they have questions about their specific situation? Who specifically they should talk to?
Well, they first should talk to their doctor. Hopefully they have a doctor. But I think the issue of chronic disease is very important because we know that individuals with diabetes, hypertension, various other chronic medical conditions that are not under the care of a physician, not taking medication for their conditions, not monitoring and taking care of their health, do much worse when they get COVID. And so it is very, very important that people have a doctor, that they seek regular medical care, and that if they have known conditions like diabetes, hypertension, high cholesterol, that they are managing that they are taking their medication so that if they do get COVID, they'll have the best chance of a healthy and safe outcome. We just can't stress enough the importance of regular exams. And unfortunately, during COVID, a lot of people have been afraid to go to their doctor. So they haven't went in and they haven't seen their doctor, haven't got their prescriptions refilled. And so this places them at even greater risk should they get COVID. So absolutely, they should be having regular conversations with their doctor about their medical conditions and ensuring that they're taking care of whatever chronic medical conditions they have. Anything to
You want to add anything to that?
The other thing that I think it's important to say is that if we look at COVID and we look at individuals with serious disease, probably 90% of the people who have serious disease have underlying medical conditions such as diabetes and hypertension, asthma, chronic lung disease, and obesity. And so it is certainly important for people to try to have those diseases controlled. That's going to increase their safety, but also these are the very individuals who should be getting the vaccine. So it's very important that we take that into consideration.
Chrissy on Facebook wants to know, and Dr. Hewlett, you mentioned this briefly already. She asks, if we get one of the vaccines, how can we be guaranteed that we can get the same kind next time? I'm very concerned.
Well, that's because you're going to get an appointment when you get your first vaccine. They're going to give you an appointment for your second one before you leave. And they will know exactly what formula you got, whether it was Pfizer, or if it was Moderna, and you will be given an appointment for that same product at your second appointment.
Okay. Steve asks, with the COVID numbers rising in Westchester and an anticipated long wait for the general population to receive the vaccine, what are your recommendations for guidelines for families with children to stay safe in the interim?
Well, I think they need to continue doing all the things that we have done in the past year. I think the schools have done a really great job. I can tell you that your children in schools are safe. We've not had any large outbreak. Well, we haven't had really any outbreaks to speak of in our school districts here in Westchester. I mean, there have been cases within the schools, but those were largely in individuals who were exposed outside of the school system. So I can tell you that I think your children are safe in school. And we just need to continue to do the social distancing, the mask wearing, not congregating in large groups. One of the areas where we have seen some concern is outside of school sporting events such as hockey. And sometimes these individuals may be traveling, children may be traveling across state lines and participating in competitions, games, and we have seen some spread within those types of events. But if you're wearing masks, social distancing, doing all the things that we've asked, shouldn't be any more of a problem than it's been in the last year.
If I can add one thing, and this is something that we have seen at the health department and in talking with some of the officials at the schools following the holiday break. Please don't get on an airplane with your child. Don't fly across the country to some other areas, because people are coming back from other states, from California, from Florida, where they've been in contact with people who have had COVID, and then the child has COVID, and then the child can't attend school because of this. So this is one of the things that we would have to stress. Try to avoid travel until this pandemic is under control. I think the other thing that's very, very difficult, has been difficult for me and for my family, is understanding that we have to stay in our pods. And so I have family in different states, and so we only are able to be around those people that are within our own household. And we have to defer a lot of those gatherings that we would ordinarily have until this pandemic is under control.
If I can I want to pick up on that, because that's been a theme that we've talked about from a general societal situation, and it's a bit of repetition, but it bears repeating. We have shut down, the royal we, almost every public gathering and setting that you can think of. Children are not coming into school every day. Our mass transit systems have very low ridership. Every parade that we've had for civic purposes has been stopped. There was no ball that dropped on New Year's Eve, either in New York City or in White Plains. There was no Thanksgiving Day parade in New Rochelle, on and on. Our religious houses of worship had very moderate celebrations for Christmas and Hanukkah this year. And of course, if you go back through the overall pandemic, we lost all the major religious holidays, from Ramadan to Easter and Palm Sunday and Passover and so forth. Clearly, when the infection is on the rise, people are giving it to each other in some setting, but it's not in a group community setting. If you remember the Rotary Club, you're on Zoom with your fellow Rotarians. If you're having a meeting of your neighborhood association leadership board, you're not sitting around a conference table doing this. So it comes down to a place where no Department of Health can reach. There's no place where the county police department can reach when you're in the privacy of your own house and you determine to have a couple of other couples over, or you decide to have a party. We can't reach into your front door, and we're not going to. You have to know that yourself. You have to realize that this thing is communicable. And I must tell you, I saw an incident, even in the world that I travel in, grandchildren and children coming to see an aged parent, no masks, no social distancing, because they're part of a family. We don't have the disease, we're okay. And of course, that's a fallacy, and the numbers prove it. As I've said, I think a couple of times before, I'll repeat it again tonight. We had, from Thanksgiving Day until New Year's Day, 165 fatalities due to COVID in Westchester County, and that's roughly 10% of all the fatalities that we've had since the pandemic began in March. 165 deaths, Thanksgiving Day to New Year's Day. When we had 165 deaths during the middle of this period where the pandemic dropped down and before it took off again, it took us from late May to late October to reach 165 fatalities. Part of May, all of June, all of July, all of August, all of September, most of October, 165 deaths. Now in the period where we gather for Thanksgiving, we gather for Christmas, we gather for New Year's Eve, people don't want to be told what to do, 6 weeks, 165 deaths. It doesn't say it any more clear than that.
Well, I think part of the reason for this is that we know that roughly about half, 40 to 50% of people with COVID have absolutely no symptoms. They feel absolutely fine. They don't think there's anything wrong with them. And I can't tell you how many people I've seen or has told me, oh, I don't need to wear a mask. I'm fine. You know me. I'm fine. Do I need to wear a mask around you? Yes, you do. And because even I, who think I'm fine, don't know for certain every single day. So we have to assume that the people around us, even if they look fine, could potentially be infectious. And I think that what happens is those people that we're closest to, we trust them. We trust that they're okay. But the fact of the matter is that none of us really know. I mean, we could be infected and we could be spreading it to others unknowingly, not on purpose, but unknowingly. And so that's why it's so very important that no matter how great you feel, no matter how safe you think you are, that you wear a mask and that you don't expose elderly family members or, you know, those in large groups, go in large groups. You're absolutely right, County Executive.
And if I can say one other thing, specifically getting back to the issues concerning children, it's very disheartening to us, and I know I've received just literally hundreds of calls because we're dealing with the schools. We will have a child, they come back from a trip, and they were tested, and they were tested negative when they left wherever they were. And then they come back, and then all of a sudden someone in the household is positive, and then the child is tested, and then the child is positive. Now the child has impacted all of the students who are in that preschool or in that classroom. And then everyone has to be quarantined because the one child, the one family decided they were going to go out of town and then they come back. And the problem with infectious diseases is that it impacts other people. Your behavior impacts not only your child and yourself, but it impacts all of the others. And the data from our county indicates that the children are actually safer in school than they are in the community. And so if we can behave in the right way, we can keep our schools open and our preschools open, and our children will be safer, and also it will allow the parents to continue doing the kinds of work that they need to do on their own with their children in school.
It really just boils down to personal responsibility. I mean, if you get tested for COVID and your test is positive, don't wait for someone to call you and tell you that you need to isolate yourself and you shouldn't expose others. You know you shouldn't expose others. So if you test positive, you need to take yourself home and not expose anyone else. Stay in a bedroom, in a bathroom where you can be by yourself. I shouldn't have to call you. A contact tracer or a case investigator shouldn't have to call you and tell you these things. We will, but you should know that, and you should not knowingly and willingly expose others. If you're in quarantine, you need to abide by it. That means you're home. It doesn't mean you run to the grocery store. It doesn't mean, hey, I'm just going to be 5 minutes. I'm going to run into the pharmacy and I'll be right back. No, if you're in quarantine, you're home. You're not exposing anyone else. A lot of this boils down to we all have to take personal responsibility for our actions.
So the next question comes from Linda on Facebook. She asks, why don't we have the people who already have antibodies wait to get the vaccine? That would allow more people to be protected faster. Does it work that way?
I can comment on that. As Dr. Amler said earlier in response to the question about protection, we really don't know how long people are protected. Everyone responds in a different way, and we really don't have the wherewithal to do antibody testing on large numbers of people. And so we are essentially trying to focus on the groups, vaccinating the groups that are in the eligible category. So it's not really going to be feasible to do that.
The next question is, have there been any studies of a person who was hospitalized with COVID-19 and has antibodies and the side effects that the vaccine gave them? Does it work that way, the vaccine?
If I understand the question correctly, as far as people getting the vaccine and then having to be hospitalized, there are just very few reports of that. There were some individuals who got what we call anaphylactic reactions from COVID. As far as we know right now, based on the data that was available to us a few days ago, there have been close to 2 million, data on about the first 2 million shots. There were 21 cases of anaphylaxis, and I think that only, I want to say maybe 4 of those individuals ended up in the hospital having to stay overnight, and those people recovered. So I hope that that answers the question. I don't think that we really think that it's going to be a big problem in terms of people having serious reactions from the vaccine. No one, as far as anyone who was already ill, is not supposed to get the vaccine. So if someone is in the hospital for some other reason, they are not really a candidate for the vaccine. One of the criteria for getting the vaccine is that you are feeling well, you don't have a fever or other types of things. That's part of the eligibility criteria. You have to be feeling well and not with some other infection when you get the vaccine.
And I think it's important to note that, as Dr. Hewlett was saying, you're talking about a very few people that had a reaction of sufficient intensity that they ended up hospitalized. But look how many people who have had COVID have been hospitalized. The very reason that we are immunizing the medical community first is to protect our hospitals so that people who are ill can be cared for, not just if they have COVID, but if you have a car accident or you have a heart attack, you want to know that the hospitals are secure, that there are enough doctors and nurses to care for people who need medical care. But certainly, we have had so many people who have been hospitalized because of COVID, and look at the number of people who have died compared to the relatively tiny number of people that have had a reaction related to the vaccine. There's just absolutely no comparison. No comparison.
I think you're going to all like this question because there's a lot of information to convey. Steve asks on Facebook, any advice for teenagers in particular in our home? Can they socialize with 1 to 2 people? Should we allow each person to add 1 person to our pod? That seems risky since each one person has a contact in their household, but we need to balance physical and mental health, and we hear this all the time. Obviously, lots to discuss here. Dr. Emler, you want to take this one first?
Well, I think this is the problem. It becomes like a chain letter. So, you have contact with 2 people who have contact with 2 people, and those 2 people have contact, and you really don't know everyone that they've been around. So is it risky? Yes, it is risky. I understand that children, need to socialize, but it's one of the things that we've seen at the health department is these outside activities for children are where they're getting the infection. They're not getting it at school. They're getting it from their peers outside of school. So I think it's important to as much as you can, limit the exposure, limit the number of people that you are exposed to. And again, make sure that they're doing all the appropriate safeguards to prevent infection, including mask wearing, which teenagers don't do very well. They're not very happy with masks. So the one thing you can do to kind of help make the masks make them wear masks is make sure the masks are cool. Like Dr. Hewlett has this very cool Trust Science mask, which is lovely, and I'm jealous. And but if you could at least give them a mask that is kind of cool, you stand a chance that they'll actually wear it.
You have a cool mask as well.
Thank you. I appreciate that.
I think it's also important to keep in mind that these large gatherings, and we saw this at Halloween, we saw this after some of the graduations where some of the behavior actually resulted in outbreaks right here in Westchester County, we saw that. I know that it may not be the same as actually getting together, but taking advantage of things like Zoom and some of the other types of technology that's now available, that I think is something that we should encourage until we have this pandemic under control.
The next question comes from Yolanda on Facebook. She would like to know if there's a way to know if you're allergic to the ingredients in the vaccine before you take it.
There is the guidance that we have right now is that if someone is known to have an allergic reaction to a vaccine, then these are the people who should probably defer taking the current vaccines that are available. Now, from some of the work that's been done thus far, it has been shown that some of the reactions may be occurring as a result of a substance known as polyethylene glycol, or they call it PEG, and that product or that substance is present in both the Pfizer and the Moderna vaccine. We know that there is a third vaccine that is going to be coming along in development sometime later this year that does not contain that product. And I think the fourth vaccine, the one from the AstraZeneca company, and then the fourth vaccine, which is from, I think, the Johnson & Johnson company, I don't think that they will have that particular substance. And so for people who have that specific kind of an allergy, then they should not receive the vaccine. If people have had allergic reactions to foods, to medicines, to penicillin, to bee stings, and things like that, those people can safely receive the vaccine. And here at our own clinics here in Westchester, we are actually administering the vaccine to those individuals, but we watch them and observe them for a half hour before we allow them to leave the clinic. And that's really the recommendation from, I think, CDC as well as from New York State and other organizations.
But we will monitor everyone. We monitor everyone who gets the vaccine for a minimum of 15 minutes. So when you get the vaccine, they're going to ask you to stick around for 15 minutes. And if you're fine at that point, they're going to let you go. So we do try to keep an eye on everyone for at least 15 minutes.
Okay, having a little mask issue there. I'm sorry, kind of.
Yeah, Catherine, before you go to the final question, since we're down the last few minutes, I think it might be helpful for the audience to know the medical background and training of both Dr. Ramler and Dr.
Absolutely.
Hewlett, so that they know a little bit about what they've gone through that gives them the expertise that they're sharing tonight at the table. Dr. Ramler?
I did my medical training at the University of Arkansas for Medical Science. I did a residency in pediatrics at LSU in Louisiana. I did a year fellowship at the Centers for Disease Control, actually the Agency for Toxic Substances and Disease Registry, which is a sister agency of the CDC. I was in private practice for a number of years. I spent 5 years at the Centers for Disease Control, a lot of that doing chemical exposures and preparedness type work, and I was the commissioner of Putnam County doing preparedness stuff around H1N1 for about almost 7 years, and then I've been the commissioner here for 10.
Yes, and I did my medical training, my medical school at the University of Wisconsin in Madison, Wisconsin. And after graduating, I did an internship and residency in internal medicine at Harlem Hospital, which at that time was part of Columbia University College of Physicians and Surgeons. And then I served as a chief resident there. And subsequently, I did a 2-year fellowship in infectious diseases at Albert Einstein in Montefiore in the Bronx. And after that, I then served as the chief of infectious diseases at Lincoln Hospital in the Bronx. And I also served as a consultant in infectious diseases at Lawrence Hospital in Bronxville for a number of years. And while I was also engaged in that activity, I was working in the pharmaceutical industry, and I spent several years actually working in antimicrobial development and vaccine development. And I'll mention that our office, I had a private practice, a small private practice, which was located initially in Yonkers. And my wife, who is a registered nurse, helped me in that practice, and we took care of a number of patients who had HIV-related disease, and we also took care of patients who had Lyme disease. And I've been working here with Dr. Amler and colleagues at here in the Department of Health since the middle of 2019.
Great. Well, we have just about 5 minutes left, and we're getting a lot of questions on social media asking, when can I get the vaccine? I am a senior, I am a medical worker, I am this. But for everybody out there listening right now, how will they be notified when it is their turn to get the vaccine?
Well, I think I'll start. And since the state has established a website, and I'm going to make sure I read it so I'm accurate, they have the key information at, I believe it's COVID. Let me see if I can find it here.
We have it, we'll put it right up on the screen.
Can you, if you would please,
Yep.
I think it's COVID-19 health, or COVID-19 vaccine.health.ny. Follow what's
Yes.
on the screen, and you'll see that. And
New
that
York.gov.
is sort of the main place to touch to determine what's happening. If there's going to be any announcements made statewide about availabilities, that's where it is. The form that everybody is expected to complete before they are able to get a vaccine is on that. You can download it, look at the form, pre-fill it out so that when your moment comes that you'll know. Certainly for those of us in Westchester County, when we know what our distribution plan of the vaccine is going to be, and it will be at the direction of the state. It won't be our own decision of what to do and when to do it. But once we reach the point at which we will be vaccinating the general public, we will make that clearly public, as we've done so frequently here on Facebook, in the general public media, working through a variety of different other resources, the various medical practices, the various hospitals, and every place else. So the natural concern that a person has is, well, will something happen and I'll miss it? Not if you check websites as a proactive effort. If you're waiting to stumble across it on a television news program, then that's not the way to find out. Keep that website handy, westchestergov.com. Check it on a regular basis, and we will certainly be very public about it, because in order for us to get the vaccine product out, we need the public to know that the cohort that they're in is now eligible for the vaccine, and to come and to sign up and to get ready for it. And then, of course, not only the when, but the where, and that is yet to be determined as well.
Very good. We have that website up right now. We're going to keep it up to the end, which is just about now. Any closing remarks we have for the
Well,
public?
first of all, let me thank both Dr. Hewlett and Dr. Amler for bringing their professionalism to Westchester County government, and particularly to tonight's programs. I guess, Dr. Hewlett, if you'd like to make some closing comments, and then Dr. Amler, and then I'll do the final close.
Well, I'm certainly pleased to be here and honored to be able to serve. I think that this is one of the most important missions I think that we have. I don't think that any of us have ever faced anything like this, and so I think that it's very important for us to serve as educators, providing objective, scientific, accurate information for the public so that people can make wise decisions for themselves and for their families. And I'm happy that I'm able to be in a position to contribute to that and to serve with great colleagues at the Department of Health like Dr. Amler and our other colleagues, our nurses and others who are doing a tremendous job now with the mass immunization program.
So thank you, Dr. Hewlett, and we're honored that you're with us too. We do have I think we have a wonderful team at the Health Department in Westchester. I would just add that I think that this vaccine is so very important. There is a tremendous amount of misinformation out there. And just like, I wouldn't go to my beautician and ask her advice about how to fix my car. I would strongly encourage you to seek advice if you have questions around the vaccine, that you seek those questions, you seek answers from the medical providers that you know and trust. Because I guarantee you that your friends and the people you work with probably don't know any more about this than you do. So let's not spread misinformation. Let's get our facts from the experts that have the information, And I think everybody will be able to make an intelligent, informed decision if we do that. So I just want to thank you for the opportunity to be here tonight, and I want everyone to stay healthy and look forward to the day when we can vaccinate all of you.
So again, I want to thank Dr. Charlita Amler, who is our Commissioner of Health for Westchester County, Dr. Darrell Hewlett, who's a Medical Director for Division of Disease Control, and thank them both again, both for being here tonight. This is one of many Facebook Live town halls that we've had, a variety of different topics, but we will come back to this topic again as there are advances in the calendar, as we begin to see additional things happening. We'll ask Dr. Amler to come back. She may have other members of her team join us depending on what the situation is. We have many issues ahead of us in county government, and if tonight is an example of how we're dealing with the COVID-19 vaccine issue, we have professionals in every area of this government, the people who manage our parks, the people who run our correctional institution, the people who treat sewage, the people who run our bus system. I'm very fortunate as the county executive to have a terrific team of people, many of whom I inherited from prior administrations, some of whom we've brought to the table, all of whom work for the best interests of the residents of Westchester County. So we want to thank you all for watching here on Facebook tonight. You can review this broadcast anytime you want to click on. And if you have any questions, communications@westchestergov.com. We'd be happy to try to answer any additional questions directly to the best of our ability. I'm George Latimer, Westchester County Executive. Thanks for watching. Stay safe and have a good evening.